The thing I think is most important is being hyper aware. And I know that sounds really crazy, but let me explain. I can explain it in two different situations I had. So the first being, I recently went to see my treatment provider. When I got there, the very first thing that happened is I had a great interaction with the front desk who greeted me. I sat down. The manager of the clinic came out and was doing something at the desk, looked at me and said, hi. And I said, hi. She doesn't know who I am, but she said, hi anyway. So at the same time, my provider came out, greeted me, brought me down the hall. Two other providers walked by me, looked at me in the eyes and said, hello, hey, how are you? And you know what? I really felt valued. And that is part of the experience. I felt like I was part of the family. I felt like I belonged there. I felt like everybody wanted me there. When you walk into a clinic, and this often happens, the front desk is very busy answering the phone. They're like, hi, have a seat. And then your treatment provider gets you from the waiting room and brings you through to treatment. And you pass two or three different providers. And those providers are either looking at their phone for their next appointment or looking at TikTok or whatever, or they're looking at the chart of the next patient and they're not even looking up and saying hello or greeting you. It's like you don't matter.
To improve patient communication, it's the miscommunication that happens within the clinics that's detrimental for the patient communication, and that's the miscommunication between the front office staff, the regulated healthcare providers, the non-regulated, the employer, anybody like that. There needs to be communication amongst all those that are involved in that patient care. And that comes, from the first point of contact when somebody comes into the clinic. So they may have done everything online. They've never met the administrator or the secretary at the front. They need to be kind of have a script of what to say so that they know that the information that they are relaying to the patient is going to be the same information that the esthetician is going to say and that the nurse is going to say, so that the patient doesn't get multiple different messages from people. And so it's just that, a collaborative relationship between everybody, and there's no hidden secrets amongst people. And that, again, will instill confidence within that clinic if everybody's on the same page. So, and it's, doing, staff treatments and things like that, or lunch and learns, and just, keeping the communication the same and making sure that, again, you hear it quite often that a patient may call up and they have a complication and the secretary is trying to tell them how to deal with it. They should know that they are not to be dealing with or giving medical advice over the phone. That has to go to a regulated health professional in order to deal with that complication.
And I don't think it's necessarily surprising, but I think it all starts, you mentioned leadership. It's the tone at the top. If, as a leader, you really embody the importance of patient experience and it's a big and you've hired right, you shouldn't have trouble motivating your people. But just like our patients want a plan and they want a partner, so do our people. So we have to model the behavior that we want them to exhibit. We have to explain to them, show them what success looks like from a patient experience stance. And then when they achieve certain milestones, when the feedback is given, positive feedback from patients, we have to reward them, whether that's bonuses or trainings or a hug, whatever it is. You have to model the behavior that you want from people. And people just want to know what your expectations are. What does success look like to you? So I think that's what we owe our people, to help them understand the importance of patient experience in our practice.
Welcome to the Business of Aesthetics Annual Patient Experience Expert Panel webinar. This engaging 1-hour session is specifically designed to provide you aesthetic professionals, practice owners, practice managers, and administrators with actionable strategies to strengthen and enhance patient communication, improve operational efficiency, and create an exceptional patient experience that drives loyalty and success, and their leadership skills that foster successful thriving practices. Thank you for joining us and our panel of renowned industry leaders as they share actionable strategies, best practices, and valuable insights to tackle the unique leadership challenges faced by aesthetic professionals today. And we also have a very interesting gift for you tonight that I'll have more details closer to the end of the webinar, so please stay tuned for that. But a little hint, Narain Arul-Raja, who is the founder of the Business of Aesthetics Institute, is part of that special gift, but I'm not going to give anything more away, not yet. But I'd like to go ahead now and welcome our panelists for this evening, Tracy Mancuso, Tracy Hata, and Kelly Conover. It is great to have the three of you with us tonight.
Thank you.
Thank you.
Today, with our Thriving Dentist Annual Leadership Expert Panel, we're going to dig into perfecting the patient experience in aesthetics. This is a live event, so please engage with your peers, ask questions, and we are confident you will leave equipped with actionable strategies to implement immediately. Now, before we get too far into it, I'm going to go ahead and introduce myself and the rest of our panel, and I'll lead off with myself. My name is Michael Walker. As a leadership coach, professional mediator, and facilitator, and podcast and webinar host, I'm passionate about helping set leaders and their teams up for success that matters. I focus on communication, conflict, and change with my team. And at Capstone Coaching, we help people unlock and engage the full potential of an organization and its people. Our first panelist up is Tracy Mancuso. With over 30 years of experience in the aesthetics industry, Tracy has built a dynamic career in clinical practice, business leadership, and global education. She has managed her own practice, served as a clinical director in renowned clinics, and led global clinical education teams. As a certified medical laser safety officer, she is recognized internationally for advancing safety standards and optimizing treatment outcomes. Tracy collaborates with leading manufacturers to develop cutting-edge training programs while staying at the forefront of aesthetic innovations. Her passion lies in empowering others through continued patient care, mentoring fellow professionals, and championing women in the medical aesthetic industry. Our next panelist up is Tracy Hata. Tracy has spent 34 of her 40 years of nursing in the specialty of aesthetics medicine. The first 24 years with 2 plastic surgeons, where she established an injectable practice within the clinic space. The last 10 years focused on her own independent practice, and in 2016, she created THMA Consulting, Training, and Mentoring Program. And it was developed, and it currently subcontracts to 22 clinical trainers in 13 training facilities across Canada. Tracy is the past president of the ISPAN and a founding member of the Canadian Society of Aesthetic Specialty Nurses. She chaired a task force that developed the standards and guidelines for aesthetic nurse injectors recognized by the Canadian Nurse Association. And our third panelist tonight is Kelly Conover. Kelly's journey from a farm in Georgia to founding Conover Aesthetics in Charleston is one of hard work, faith, and fate. After a successful career in healthcare consulting at Deloitte, she earned her doctorate in health administration, but chose entrepreneurship over corporate leadership. Her passion for aesthetics led her to open Conover Aesthetics in 2015, alongside her husband, Dr. Craig Conover, a pioneer in performance medicine. With expertise in laser treatments, skin resurfacing, and injectables, Kelly has built a thriving practice, becoming South Carolina's most experienced ultra therapy provider. Welcome to the three of you. It is great to have you here with us.
Thank you. Thank you.
Now you'll see on your screen, you'll see on our screen the main points for today's discussion that I'm confident we will be able to deliver an amazing and a very insightful webinar. Now, we also have some great questions lined up for our panel today, and I'm looking forward to their, as we said before, their insight, their best practices, and their passion. That word passion was used quite a bit there tonight in those profiles. And I would also like to encourage you as a participant to connect with us through chat on any questions you might have, and for sure, any comments as you hear things being shared. I'll try to respond to your comments and questions as part of the webinar and during the webinar, but if I don't, Alec, our podcast manager, will reach out directly to you with an answer from our panelists after the podcast with any questions we don't get to live tonight. So nothing falls between the cracks. We value your time. We value the privilege of your time. So I'm going to go ahead and stop my screen share, and we're going to get right into the questions in a minute here. I'm just excited. I'm excited to, I think the thing, tonight we were just talking before we came online, we're just talking about the internet and the power of likes and the power of how many followers you have. And there's just and things can go viral so quickly, and every industry is affected by that. And the word dynamic comes to mind when we think about how things are changing. It just seems at times they move very quickly, sometimes a little slower, but this industry is certainly evolving. And I know that that's something we're going to be talking about tonight. So let's start by looking at how patient attitudes towards aesthetics has evolved. And I'm going to start out with you, Tracy Mancuso. And Tracy, you've been in this industry for over 30 years, and I believe, Tracy, how do you have as well, as I profiled. What's the biggest shift you've seen in how patients approach treatments, and how can practices adapt to help them feeling more confident moving forward?
It's a really good question. I've actually seen 3 really big shifts, especially in the past few years. And the first one being that younger patients are coming into our practice. We're looking at the Gen Zs and the millennials, and they're coming in not for corrective treatments like we're used to delivering. They're coming in for rejuvenation treatments. And we need to change our conversation and start adding those to our service menu, to our offerings. The second is that patients are coming in not for just one thing. They're not coming in and saying, hey, Trace, I see this little spot. I was wondering if we can take a look at it. They're looking for global changes. They're coming in for a more comprehensive consultation. They really want to see, what can you do to make me stop looking so tired, to make me look more youthful, to turn back the clock a little bit. And then the last thing is really the shift we've seen in natural looking results. And that natural shift, we really need to change our verbiage in what we have in our social media and what we're posting and what we're reflecting back to our patients, to make sure that they understand these are the type of results you can expect from us. And that's what's really important when we're looking at how our patients' attitudes have changed and how we're supposed to change that communication. It really does come down to offering better treatments that are rejuvenation, doing that comprehensive consultation that is global and encompassing, and then also changing our verbiage. And I'll sort of call it one of the panelists here is Kelly. I've been stalking your social media today. I was looking at it, and I noticed you have a lot of younger patients on your social media. Some of your before and afters too, and your verbiage is great about all of this sort of more subtle enhancement. And so maybe you can sort of weigh in a little bit on that as well.
No, I absolutely agree with everything you're saying, Tracy. We're seeing 2 types of patients, really. Patients that are coming into the clinics earlier, as you mentioned, but we're also seeing older patients stay in the clinics longer. So that's been a really interesting shift. I think certainly the focus, the baby Botox trend, all of these things, the focus is definitely shifting to more prejuvenation, maintenance, natural results. The days of overfilled lips and cheeks, et cetera. I think we're starting to phase out of those. I think another interesting shift is, it seems like we go in waves with surgery. So when the medical aesthetics, is in vogue, surgery is out, and vice versa. And we're seeing a lot more patients turn to surgery sooner in our practice. So I definitely second everything you're saying. And I'm pleased that you saw our social media. Thank you.
I stalked all of you before, so not to worry.
Thank you, Tracy, and thank you, Kelly. You know what I mean, listening to this and having talked to quite a few folks in the aesthetics industry, the term that jumps to mind for me in this is the concept. Really, it used to be just a kind of a catchphrase for a lot of different stuff, but I think it really is coming down is holistic wellness. And the idea of wellness that's not is mind, body, and spirit. Like there's that, people want that comprehensive, the rejuvenation in so many different ways. And I think that there just seems to be, and I love what you said, Tracy, about making sure that how is our messaging lining up with was it Marshall McLuhan said, the medium is the message. Now, is it lining up? Is it current enough? Or have we become, just, we need to spend a little time making sure we are current. And yeah, I love the way you put it. Thank you, guys. Tracy, I'm going to go ahead and ask you a question, if that's okay. And the question I have for you is, you've trained many injectors over the years. When someone is just starting out, and that's one thing, with our audience, we all have folks here that are perhaps brand new or just starting out or looking at it, and we'll have veterans who are looking for some insight and some encouragement and some inspiration perhaps, but we'll also have folks that are looking at expanding. So we have a lot of different folks in the audience. But when we talk about when someone is starting out and talking about injectors, what's the one key skill or habit they should develop early on? And this is such a big word in your business, to build trust with patients during consultations.
Yeah, I think the main thing that I find to be important is that people in this specialty, or new injectors in this specialty, they need to know how to conduct and understand the importance of a medical history, of a thorough medical history. And that includes facial assessment skills as well. You're looking at, the medical history as well as the psychological history. With our trainings, we provide them with a 4-page medical questionnaire that they can go through with the patients, plus they have a 3-page assessment checklist so that they know what they're looking at. But in order to have good assessment skills, you need to have good communication skills. So we kind of, impress on them, you need to have good eye contact, because a roving eye doesn't instill confidence when you're talking to somebody. And then listening without interrupting, giving them time to actually, speak what they want. They're going to be nervous coming in talking about their insecurity. So give them time to talk. Don't fill in the sentences for them. And learn how to use open-ended questions. So it's not just a yes or no. I mean, there's nothing that bothers me more than you go into an office and they give you the medical questionnaire and you fill it out yourself. We tell nurses you have to go through it with them, because patients lie. We know they lie. They might have gone to another provider and they turned them down because they were having a dental appointment done or something. So and then they know, okay, well, I'm not going to say that because they're going to turn me down. So they need to know what what questions they are to ask, but why are they asking it, and letting the patients know why they're asking that question. It's sort of, do you smoke? It's not a yes or no, yes, I do smoke, but tell them why. That, if you do have a vascular occlusion, then we're going to ask you to quit smoking. Are you okay with that? So really impressing that we really want them to know and understand that medical history and the importance of it. And I just tell them, talk to, do the whole thing, get it down to a fine routine so that you're not missing. And it's very smooth, because patients will be able to sense if you keep looking at a paper, wondering whether you forgot something. So get really used to it. Interview your mother, father, cat, dog, anybody, and just get used to the questions. And again, not just yes or no questions. Tell them the why, not just the yes or no. So that's kind of what we impress on people. And I think that really does build a confidence with patients.
Yeah, thank you, Tracy. And that whole, we know that trust can't be trained, it has to be earned. And we have to be intentional with processes to do that. And what's that saying? People don't care how much you know until you know how much they know how much you care. And I think you just hit the nail on the head. Information sometimes feels like it's it's almost a barrier to entry to something they're looking at. And so I'm thinking, I put my hand up as being one of those people that have not told the truth. and I think about that, I said, well, why? What was my why? It was because I didn't want it. I was either embarrassed by it, or I didn't want to, I didn't think would that be that big a deal. Apparently I have a degree in medicine. So it's kind of that process. But I think building that trust is so powerful. And I think the way you're approaching it, I love that, just being intentional with information, but in a complementary way, and that it's building that trust. So thank you very much for that. Kelly, I'm gonna head over to you. And Kelly, when you were building Conover Aesthetics, was there a moment when you realized that the patient experience was just as important as treatment results? And how did that shape how you approach care today?
Yeah, so I presume, like many of you, I got into the service industry because I genuinely derive a lot of joy from serving others. So I'd like to say that the patient experience, a positive experience, has always been top of mind. But I think the moment that it became most critical, and more than just a buzzword in the industry, is post-COVID. So in COVID, this really awesome thing happened. The medical spa industry exploded. And if you're in an area like I work in Charleston, South Carolina, our market is now defined as hyper congested. We like to joke that we have more medical spas than we have people. So, and that's true in many respects. So a few things happen when you have a congested market. The first is commoditization. So many of these services become pretty commoditized in nature, just like bread or milk. You can get Botox at pretty much anywhere here now. So the commoditization has changed things. The other thing is that when you have a commoditized market, people become very geographically bound. So you think about it in your day-to-day activities, you probably go to a gym that's close to your home, a grocery store, a dry cleaner close to your house. People don't like to travel. And they can get geographically bound because there is one on every single corner. So I think in a market like I'm operating in, where we're all vying for the same patient base, patient experience is really, it's no longer just a buzzword, it is everything. So if you're looking to differentiate your business, the results are no longer enough. If you're not focused on patient experience, odds are you will be out of business very soon.
Yeah, I mean, I can, as we were talking before, Charleston being, I shouldn't probably say it out loud because you get more people, but being one of the top cities in America, but this idea of patient experience, it's interesting if we actually think about patient experience from the standpoint of not only will have setting unexpected, doing something that's unexpected from someone to actually go that extra mile. It also is such a huge building block when you have a great patient experience with customer referrals.
It's everything.
Pre-qualifying people, and it's just such a gift. And the interesting thing is, you said at the outset, we're a joy of serving others. I mean, I think that's the essence of this industry or any industry where it's about helping people be the best version of themselves, however that may unfold. We're part of that journey. Our team want to be part of that too. They want to, and the question is, are we giving them the right tools and the right? Obviously, in your culture, you're doing that. That if I went and talked to your staff, they get what you just said, and that's very cool. So thank you. Tracy Mancusa's got the next question. Cuso, pardon me. I just have a whole new version of your name there.
Okay.
Tracy, we know small adjustments in practice operations can have huge impact. Can you share a time when a simple change made a big difference in patient flow and overall experience? We seem to be heading down this patient experience road right now.
Absolutely, it is, and it's key to everything that you do is the patient experience. One of the things that I found was really, really impactful is taking part, and I'm going to say this very carefully, part of what you do online. The part that you can do online and automate, which makes the patient have a more seamless flow, is some of the intake forms. Now, like Tracy Hoda has said, I don't like doing a medical history online. I prefer to do it live with the patient because not all patients are, forthcoming with some of the medical history. And some people just don't want to write it down, to be honest with you. So what I'm talking about when I say some of your forms is some of the forms that we like to have about lifestyle. We also like to ask them about some of their feelings, about some of the treatments that we offer, what their goals are. I like to have those kind of things streamlined and done prior to the treatment. However, and prior to the consult, however, I'm going to caution you here is people will send those in, and then the next time that they hear from someone is at the consult. And that really makes a very cold and very not easily flowing process for the patient. They don't see it as something that is very seamless. What is better is after they've submitted, a human person actually contacts them and says, I'm just going to go over and confirm we've received all of your forms. A couple of things here that you didn't fill in or that maybe aren't clear that I just want to go over with you. And you have that human connection, because people forget in our industry that these are very personal services. You can't take the personal out of that just by doing everything automated and making things so, computer generated and so efficient. So some of it you have to step back a little bit and go back into that personal world. And so that's where I find just that one small change of doing the upfront small forms and having that one person contact them makes a huge difference. It shows that you care. It shows that you care about their time as well, and you're efficient with their time. But you're also going to take the time when they come in for their consult to go over things that are very important, like the medical history, etc.
That makes a lot of sense. And I have a question for you. It's just an aside. I think of you've been talking about these medical histories and all the data is king these days, as we know, always has been, but it's a little more prominent now. But it's one of the things that I've noticed is that, as a matter of fact, I just did a history with a podiatrist just the other day. And I was going through it and the questions were repeating. I said, the one thing that was missing was there was no vision for the document. Like, why do you want all this information? How is this going to impact what we're going to try and achieve here? What is that doing? And it just caught my attention. I thought, what's the why in this? Like Simon Sinek's book talks about, what's the why? This list is, it's not just that we're trying to find something to exclude you from something, but we're actually trying to figure out, know enough that we can go beyond your, perhaps even exceed your expectations, but this is about really us being able to deliver the most holistic wellness service we can. So I don't know, that makes any sense. Does it, Tracy?
It does. It definitely does. And I think both Tracy and I are on the same path here with that, is that when you're going through a medical history with someone, you have to understand why you're asking those questions. And I can't tell you how many times I've looked at a medical history and asked the professional, I've said to them, so can you tell me why you're asking this question? And I'll say, well, it's on the medical history. That's not good enough for me. I have to know why you're asking it. What are you going to do with that information? Doesn't matter if they've ever had a surgery. If it does, then you have to explain that to the patient and say, I'm asking you about surgeries because XYZ. I'm asking you about medications because of XYZ. And Tracy, I'm sure you can elaborate more on this.
Yeah. I mean, it's even, having a vaccine, so, how does that matter? Or I'm just getting my teeth cleaned. That's not a dental appointment. Yeah, it is. Or facelift. Oh, that's not surgery. That's just a cosmetic thing. That's a huge red flag for doing injections. So, explaining it to them of why you're asking the questions, I think, and then they go, oh, it's an aha moment for them that they may not have gotten at another clinic.
Perfect. Yeah, I think it's a word that I really enjoy is the word of, it's about being intentional, not just planning, thinking about doing, what are we actually going to do here? How are we actually executing this with a framework, with a vision, with a strategy? Thank you, Tracy and Tracy, the two Tracys. Yeah. The next question I have up is for Tracy Hada. And speaking of operational shifts, Tracy, you've seen how different clinics handle patient communication. What's one common mistake you see? And what's a simple fix that could instantly improve the patient experience? Now, this is wow. We talk about best practices. We talk about hands-on. One of the things I encourage our listeners that these are the kind of things, if you can grab something tonight in this webinar that you can apply immediately, something you can use. Sometimes we get to these, we get a ton of information, but we're almost information paralyzed. Try and capture a soundbite or something that you can take and implement immediately to make the shifts that you're looking for. And with that, I'll turn that back over to you, Tracy.
Okay. So I think to improve patient communication, it's the miscommunication that happens within the clinics that's detrimental for the patient communication. And that's the miscommunication between the front office staff, the regulated healthcare providers, the non-regulated, the employer, anybody like that. There needs to be communication amongst all those that are involved in that patient care. And that comes, from the first point of contact when somebody comes into the clinic. So they may have done everything online. They've never met the administrator or who the secretary at the front, they need to be kind of have a script of what to say so that they know that the information that they are relaying to the patient is going to be the same information that the esthetician is going to say and that the nurse is going to say, so that the patient doesn't get multiple different messages from people. And so it's just that, a collaborative relationship between everybody, and there's no hidden secrets amongst the people. And that, again, will instill confidence within that clinic if everybody's on the same page. So, and it's, doing, staff treatments and things like that, or lunch and learns, and just, keeping the communication the same and making sure that, again, you hear it quite often that a patient may call up and they have a complication and the secretary is trying to tell them how to deal with it. They should know that they are not to be dealing with or giving medical advice over the phone. That has to go to a regulated health professional in order to deal with that complication. And there's been a couple of incidents in Canada that the clinics got into trouble because the secretary figured that she had the know-with-all to deal with the complication, and the patient didn't get cared for properly. So.
Thanks, Tracy.
To improve communication, it's dealing with the miscommunication.
Yeah, and I think with that, the other question that kind of jumps to mind too is on the other side of it, what are the patients feeling that we're not doing well in communication? Where are our gaps in communication? How are we listening well? Do they feel valued and heard? Are we? Somebody just talking about, I get these emails that if I was a neurologist, I totally understand it, but I'm not. And are we communicating at the level? How do you guys do that? How do you make sure that we know what the patient's needs are, and we're talking about how they can be met, but how do we know what the needs are?
Yeah, it's listening to them. Really giving them time to express their concerns. And when we talk about communicating, being eye to eye with the patient, don't stand over on top of them, because then that's an authoritative position. But really listening to what their concerns are and listening to red flags, because we all know that there's a lot of red flags in aesthetic medicine where they may not be an appropriate candidate for doing a treatment, that they may need some other, if they're, deemed BDDE or they're excessive compulsive, we need to be able to point those out as well. But really listening to the patient.
Yeah, and you just said earlier, the whole idea of active listening, which is the open-ended questions, paraphrasing, summarizing, all those type of things that I do as a mediator on a regular basis. But it's not something we normally practice. We tend to and we're surprised when we just get yes or no answers back. Yet we set it up for that because we didn't take the time to ask an open-ended question. So, well put. Kelly, coming back to you, high-end service is becoming the standard in aesthetics. Have you taken inspiration from other industries to elevate the level of care at your practice, and what's worked well?
Yeah, so I've been an entrepreneur for the last 20 years with a variety of different businesses in different industries. I've also spent, the last 10 years I've had Conover Aesthetics, but prior to that, I worked as a consultant for Deloitte & Touche. So part of my job at Deloitte & Touche is we would go into these businesses, we would meet with management, meet with senior leadership, and we would perform a risk assessment or a gap analysis. And we would help these businesses, this management team, identify the risk in their organization or improvement opportunities, whatever that was, whether they were operational, financial, compliance related, whatever. And what we would do is we would come up with a plan with management. And then in addition to having the plan, we would roll up our sleeves and really partner with management to see it through. And where I think that relates to aesthetics is our patients are no different. You've mentioned that people want to feel valued and heard. They want a plan, and they want to know that they have a partner to journey through this plan with them. Everything starts and ends with relationships. So I think that is why I am so passionate about the patient experience is, Our patients walk in the door with a problem and they're seeking us for the solution. And so we owe it to them to listen, as Tracy mentioned, and really develop a comprehensive aesthetic care plan that is going to give them wow results. That's really what everyone is coming to us for. So yeah, that's exactly what we've done. We've developed really comprehensive aesthetic care plans, and we've let the patients know that we are a partner with them on this journey. Those are the strategies that have worked for us.
Yeah. And I
Yeah.
think it's interesting when you said, relationships are the start and the finish. I mean, that really, we tend to look at organizations as that there's three spaces. There's a transactional space, which is about what we do and how we do it, which in the old days, that used to be good enough.
Right.
And then there's a relational space. It's about who we are and why we matter. And we see when those are working well together, the creative space emerges, which is where you're the best employer, where you have courageous conversations. That's where you have outside the box ideas, all that stuff. And when they're not working well, that's where we have conflict. And that's when things start to crash and burn all around you. And I think what you just said is that, especially coming from a Deloitte Touche background, the transactional is their bread and butter at some level of the processes. But without the relationships, all the planning in the world is mute.
Right.
And I love the way you put that in there. That's great. And I think that's often you bring that from a business and an entrepreneurial background, but that business background, it's so important. And I just mention here, like, you're going to be able to reach out to these professionals after this session. And we all need mentors. We all need coaches. We all need people that can come alongside us and support us. I'm not, I would never plan on doing my own facelift, even though I could Google it and probably figure out how to do it. I'm going to hire a professional, and so I just encourage you as listeners, if there's something here you're hearing, that's part of what this journey is about, is you're getting to meet three people that are experts who have the similar passion to you in a field very similar to yours. So thank you, Kelly. Let's go back to Tracy Mancuso. And Tracy, from your work with different clinics, what's one thing every team member, whether at the front desk or in the treatment room, can do to make a patient feel valued during their visit?
Well, the thing I think is most important is being hyper aware. And I know that sounds really crazy, but let me explain. I can explain it in two different situations I had. So the first being, I recently went to see my treatment provider. When I got there, the very first thing that happened is I had a great interaction with the front desk. She greeted me. I sat down. The manager of the clinic came out and was doing something at the desk, looked at me and said, "Hi." And I said, "Hi." She doesn't know who I am, but she said, "Hi," anyway. So at the same time, my provider came out, greeted me, brought me down the hall. Two other providers walked by me, looked at me in the eyes and said, "Hello, hi, how are you?" And you know what? I really felt valued. And that is part of the experience. I felt like it was part of the family. I felt like I belonged there. I felt like everybody wanted me there. When you walk into a clinic, and this often happens, the front desk is very busy answering the phone. They're like, "Hi, have a seat." And then your treatment provider gets you from the waiting room and brings you through to treatment room, and you pass two or three different providers. And those providers are either looking at their phone for their next appointment or looking at TikTok or whatever, or they're looking at the chart of the next patient and they're not even looking up and saying hello or greeting you. It's like you don't matter. And it doesn't make me want to go to them either. It makes me just feel like another number. Now, I'm going to give you another example of something that was hyper aware. And so I went to a different clinic for other purposes. And I was sitting in the waiting room. It's very, very cold. I have to tell you that Ottawa right now is frigid. So I was sitting in the waiting room. It was really cold. Had off my shoes, had off my coat, and so was another patient that was sitting there. She had on her socks and she had off her coat, and she was shivering. And she was sitting there and she was tapping her hand, tapping her hand and tapping her hand. She looked at me like she was in high anxiety. The person at the front desk needed to be hyper aware that that patient was feeling anxiety. They needed to get up and go over and offer them a blanket. And hey, I know all of you are going to say, "Hey, Tracy, that's more laundry," but trust me, it's worth it just to have some thin blankets around with places that are a little cooler. But, offering her a blanket, maybe some warm tea or some warm water with a lemon, and then just comforting her a little bit and saying, you know what, Stella's going to be with you in just a few minutes and she's excited to see you. You know what, that really brings down that anxiety. And if there's a lot of people in the waiting room, maybe moving them to a different location that possibly is a little quieter. And I'm not saying to triage them into a treatment room and leave them there by themselves. That's horrible too. But you want them to be put somewhere maybe that's a little quieter. And that's why I often say a secondary seating area is really nice as well, just to give them another space to go to that's quieter, people coming and going and phones ringing and things like that. To make the situation worse, while she was very nervous, the front desk staff was talking to another treatment provider who was actually having a problem with a patient, a complication was going on, and they were discussing that at the front desk. And like everything that could have gone wrong, it was like the perfect storm for this poor woman who was waiting for her treatment. And so again, it's about being hyper aware who's in the clinic and making sure they feel welcome, and being hyper aware of the people in the waiting for the brand new people. How are they feeling? This is a new experience for them, or maybe they're coming in for new treatment, even though they've been to your clinic before. Just observing them and teaching the front desk staff, hey, when people start doing these type of behaviors, go over and start comforting.
Thank you, Tracy. Yeah, I mean, my original career was in the hotel business, and we always talked about it's easy to meet somebody's needs if you know what they want and just deliver it. That it's not hard, particularly if you have the manual. But as soon as there's a wrinkle in that, and people tend to throw wrinkles into stuff, then you have to know something about yourself and other people in a way to be able to communicate with them and have a clear vision for that. But I think what you're talking about, what I love, is this idea of how do you unexpectedly delight somebody? Well, you arrive with a blanket, and that's where you get, and I mean, you guys generally want to do that because you genuinely care for the person and you're aware of that need. But while you're doing that, you're also building out an incredible, powerful review that's going to have a huge impact on how you're seen as a caring professional organization. Conversely, if you just ignore that person, that review could go a very different way. And we have to be intentional with it, being aware of reviews. We don't want to lose sight of the intimacy and the personal touch, but at the same time, it goes hand in hand with our virtual world. So, thank you very much, Tracy. Tracy Hata, I'm going to come back to you. Feels weird using your last name in a webinar. Anyway, we all know that having the right team in place is key to delivering great patient care. And so from your experience, what's one strategy that really helps teams stay consistent in delivering top tier care?
I firmly believe, like, if you're a employee and you've got an employer, even if you're a contract in a clinic, I think there's certain incentives that can, enhance patient care and outcomes. And that's adding into the contract that it may be a set amount, but attending educational sessions. So I know when I worked for a plastic surgeon, every year he would give me a certain amount of money that I could use towards attending whichever meeting I wanted to. And that's reinvesting back into the practice, because you know that they're going to be learning, some new evolving trends. Typically what I would do, or what I would tell people to do, is that if you're going to that meeting, then you have to come back and you've got to teach it to everybody else, everything that you learned at that meeting. So it's not just going to the meeting and having fun. You really have to take your notes, and you have to come back and you've got to, tell everybody else what you learned. And it's also ongoing information within the clinic itself. So, lunch and learns, group webinars. Here's a great webinar. Get everybody together, whether it's 2 people or 20 people, get them all together to do the webinar together so they can have an open discussion. So this could be admin staff, nursing staff, the owner, just so that everybody's sort of on the same page. And then that's going to enhance the patient care and the patient outcomes as well, because everybody's learning together and you're not learning in silos. So I think, again, that's that collaboration within a practice that's going to be felt by the patients as well.
And from what you're saying, Tracy, it has to start with leadership.
Yeah.
That's not something that just happens midstream. It has to be part of the vision that's cast by the leadership, that's something they're passionate about when it comes to developing their people, building relationships with their patients, and making a difference in their community.
Yeah. And if the employer doesn't agree with it, then it would be up to the nurse or whoever it is to explain to them the benefits of me going to this meeting and coming back and look at everything that I can learn and bring back to the clinic to improve the patient care. Because there has been that where the employer is like, well, I'm not going to give you $2,000. But then when they realize the benefit that they're going to get back from an excited nurse coming back from a meeting with new ideas, then they typically will change their focus. Yeah.
And that's so much better than giving people commission, because I know, Tracy, how you feel about commission too. We're on the same page, and we work closely together, actually, Tracy and I. So I know how she works. So she feels the same way. I'm not a fan of commission. I'm a fan of giving people back things that help develop them. And I love what you said, Tracy, about it being about education, because people love that.
Yeah.
Yeah, everyone likes a great story, and coming back. And I've been around long. I was with your competition, Kelly, and we had. I was around when we first had the world of spreadsheet technology. Prior to that, I remember doing columnar lists of all the hotel occupancies in the city of Toronto. But suddenly overnight we went digital, and the partners didn't want anything to do with that. That's just a waste of money. So we put one computer in the partners lounge, and we put Pac-Man on it. And within a month, everybody had computers. I'm not going to mention the firm. But Kelly, that kind of brings me around to you, and as a leader, and I'm going to go ahead for all of you as influential leaders, and I'll unpack what I mean by that later. But as an influential leader, what's been the most surprising lesson you've learned about keeping your team motivated and inspired, I'm sure, even on those tough days?
Yeah, I don't think it's necessarily surprising, but I think it all starts, you mentioned leadership. It's the tone at the top. If, as a leader, you really embody the importance of patient experience, and it's a big and you've hired right, you shouldn't have trouble motivating your people. But just like our patients want a plan and they want a partner, so do our people. So we have to model the behavior that we want them to exhibit. We have to explain to them, show them what success looks like from a patient experience stance. And then when they achieve certain milestones, when the feedback is given, positive feedback from patients, we have to reward them, whether that's bonuses or trainings or a hug, whatever it is. You have to model the behavior that you want from people. And people just want to know what your expectations are. What does success look like to you? So I think that's what we owe our people, to help them understand the importance of patient experience in our practice.
And you hit with that. Thank you, Kelly. That word, success. What does success mean? If we went and asked a whole group of people, if I'm talking to any of our listeners or viewers, if you went and asked your team, all of them, what their definition of success was, do you think you'd have a consistent answer? I'm guessing not. And that's what you're talking about, Kelly, is about being intentional with that.
Right. Absolutely. I think you have to lay out to them what success looks like to you and what a positive patient experience will achieve. And then, people work with autonomy. Obviously, we don't micromanage them, but it all starts at the top. It's all leadership.
And I alluded to influential leadership. So that's what my company, we coach influential leadership. And the definition of influential leadership, you guys are gonna love this, as well as our viewers. It's the idea, an influential leader is someone who gives something they didn't even know they needed or wanted. But once they have it, they can't imagine living without it. And then the crazy part, they can't wait to give it away. And isn't that what we're doing? You know, that's what we do here. That's why we're doing this, why you guys have graciously given your time and your expertise and your passion to share with others. And, you know, who's going to take something today that they didn't even know they were going to get, but boy, oh boy, it's just changed everything in how they're looking at something within their practice. So leadership is such a, such a dynamic force. It's not just a nice word anymore. Let me go to Tracy Mancuso. And Tracy, the question I have for you is, many clinics try to improve the patient experience, but don't always see the results they expect. From what you've seen, what's one common mistake they've made, and how can they fix it, or how did they fix it?
So one thing that I've seen, and I actually see it repeatedly now more than ever, is this over automation. And so in our zest to be very efficient and to reduce costs associated with time, what we've done is we have online booking, and then we have auto confirmation, and then we have auto check-in, and then we have auto payment, and we have auto receipts. And then you get into this auto email loop of things sending you, oh, now that you're having Botox treatments, you would probably also like some filler treatments. And I'm like, this is so automated. It's not personalized. You obviously don't care about me. In that loop, we forgot about the one thing, which is patient. They're human, and we forgot to be people. And so oftentimes when clinics have adopted this hyper automation into their practice, I see all of a sudden a drop in their revenue and say, I wonder what happened. My patients are going elsewhere. And I'm like, because you're missing the human touch. I'm not saying to go back to a pad and paper and write down all your appointments. And I'm not saying to do that, but I am saying to look at your processes and see where you can add humans back in. Because again, these are touch services. These are very personal decisions that people are making. And you really need to have those particular touch points with your patients, and you need things to be personalized. I had actually an experience, and it wasn't in our industry, but it was a shopping experience. And I was just at a regular store, and I actually posted this on my Instagram because I found it so impressive. And it was at a large chain of drugstores. And I made a purchase, and I purchased more than I normally would have because the girl in the department was very good with me. She was helping me out. She was chatty, and I actually enjoyed our interaction. When I got home, I opened my bag, and she had slipped into my bag a handwritten note. And even more so, she was like under the age of 30 and wrote it in cursive. So I was really impressed because we all know they can't write cursive now. So I was really impressed. But it just made such a difference to me that I would drive out of my way to go to that store and see her again because it was so personal. And I know she wrote that note in advance and put them all in the drawer and all that, but it was the thought to do that. And it was the thought to put it in there that made the difference to me. And it's those little things that you can do for your patients that will make a difference. Stop being so automated and looking at how fast can I get all of this done, and look at how can I impact the patient's experience and make it more meaningful for them. When they leave, they leave and go, wish I didn't have to leave, even if they got 100 needle pokes.
Thank you, Tracy. What came to mind, I've never really thought, you just used the word, stop me, shift from purely an automated experience to make sure that you're incorporating an intimate experience. And
absolutely.
Touching the heart, not just the head, and very well put. Robin, I see your question. I'm going to get to that just in a couple of minutes. So thank you so much for putting that question up. And our panelists, you can see that in there, and I'll put that out in a minute. But I want to go, before I do that, to back to Tracy Hada. And the question I have for you, Tracy, is patients today have endless information online, which can be overwhelming. How do you train practitioners to educate patients in a way that's clear, helpful, and not too much all at once? I'm very interested
in the answer on this one.
Yes.
Health literacy is a very much a buzzword in our in medicine right now, and that refers to an individual's ability to find, understand, and use health-related information to make decisions and take action. So, as we know in aesthetic medicine, is that we have to do informed consents. We have to make sure that the patient understands everything that we're saying. So again, it goes back to that communication, having open-ended questions, giving them time to think about, what their concerns are, not filling in the blanks for them. I mean, research shows that they only understand, 60 to 70% of what we say, and they retain less than that. So keeping your treatments to 2 or 3 different treatments. Don't overwhelm them with too many treatments. And all of a sudden they're like, well, lasers and microneedling and Botox and fillers and everything. So looking at their number one concern and addressing that and doing a treatment plan, a written treatment plan that they can understand. With the communication, maintaining friendly attitudes. So that goes along with what Tracy was saying, to make them feel comfortable. And then, avoiding medical jargon. So that goes with the health literacy, in that, we want to impress people with how much information, that we know all the names of the muscles and the blood vessels and everything, but patients don't need to know that, and they don't want to know that. So making sure that we understand the literacy level of the patient and talking to them in that form and getting them to answer, doing a teach back, so that we can make sure that they understand what we're talking about before they actually make a decision and do their informed consent. And also having your education tools as well. One, have you had the treatment done before? So you can talk about it from a personal level. Really will help to reassure the patient. If you've had it done before, I don't think there's anything worse than going into a dentist that has bad teeth, or a laser eye surgery and the doctor has, huge glasses on. You have to be able to talk about it, and that if it's safe for you to do it, then, or your mother to have it done, then it's safe for other people. And, before and after pictures, anything that you can do to have a different type of education than just talking to them. But I think, talking on their level.
Yeah, I love that term, health literacy. I like that. That makes a lot of sense. I think just keep it simple, and that saying, people don't care how much you know until they know how much you care. It's the same, exactly the same. Thank you, Tracy.
Yeah.
Kelly, I've got a question for you, and then we will we'll move to the question we have from Robin, and we'll be wrapping our things up here in a couple of minutes. But Kelly, if you could give one piece of advice to other aesthetic providers on improving patient experience without spending any extra money, what would that be? And what's one simple thing they could do to make their patients feel more valued? Oh, pardon me, I already asked you that question. So yeah, let me put that question back up. If you could give one piece of advice to other aesthetic providers on improving patient experience without spending any extra money, that's a tall order. No money. You can't spend any extra money. That's it. It's like going to the island.
Yep.
What would it be? You're muted, Kelly.
Sorry, you said keep it simple, so I will. And Tracy Mancuso, you will appreciate this. Answer the phone and smile when you do so. That is about the cheapest piece of advice that I can give you for how to improve your patient experience. Everyone thinks about the patient experience as these big things, but really life is just a series of small things, right? So it's all of the little things that add up to contribute to an amazing or non-amazing patient experience. And it really starts before that phone rings. So it's just the entire life cycle with this patient, from the time the phone rings to they come in, how they're greeted in your practice, the follow-up that's done. There's a lot of business in aesthetic medicine that's lost to lack of follow-ups. And that is all that patient experience. So best piece of advice I can give you is answer the phone when it rings, ideally in 2 rings, and smile.
Awesome. Now that's worth $1 million. So, ladies, you've seen, I'm just going to read what Robin has here. I don't know if you've seen it. If one of you are able to comment on this, that would be great. She says, I've had another provider approach my patients while they were waiting in the waiting room. She was trying to sell them some of her products. I had several clients complain about this to me. Has anyone come across this scenario? And went on further to say, the clients indicated they felt trapped as they were waiting for their appointment when this provider approached them. And she added, this other provider is not in aesthetic medicine, but an entirely different healthcare profession.
This actually goes to two things. One thing that Kelly said, and one thing that Tracy and I were saying, is that Kelly was saying it all comes from leadership, and it does. It's going to come from the top, saying this is not how we conduct ourselves in the clinic, and this is how we approach each other's patients. You should speak to each other's patients, make eye contact, say hello, those kind of things. But we're not there to try and push any treatments and things on those patients. And then, like Tracy and I were saying, that commission is usually the evil in these cases. And maybe this person was on commission or something that got incentivized in some way that is causing them to have this type of action. But I'll certainly hand it over to Kelly and Tracy to comment on that as well.
Yeah.
You go ahead, Tracy.
I'm reading it again because I think it was not a provider within her clinic, but
It was
I
a
think
clinic
it was
owner.
another.
You just said it was a clinic owner.
Oh, was the clinic owner?
It was a clinic owner. It was the clinic owner, yeah. So we just
That's terrible.
Yeah.
That's pretty terrible.
I think we could all agree that
She was the clinic owner.
yeah, and that you're kind of moved into my world of mediation. That's where you've got a difficult conversation that is not anywhere near appropriate to be happening in the waiting room, and it never should have occurred, that situation. But that's where really need to take that conversation aside. Say, we talk about we call them, just quickly, BFCs, behavior, feeling, consequence. Behavior, when you came into the waiting room, started saying that, you made me feel that you were making myself and other people uncomfortable, and as a consequence, we had a couple people complain and aren't coming back. BFC, and it's the idea of it creates a space for a mediated conversation that doesn't have to be taken personally, and then you can discuss that. But if you want to reach out to me, I'm not here to do that kind of work, but I'd be more than happy to explain more of that for you, Robin, as well. You'll find my website, or reach out to any of the ladies here as well. But I just want to encourage you that I just got watching our time. We're coming in. We did start a little late, so I apologize. We're going to run a couple minutes over because I did promise a couple of things. So I'm going to go ahead and share my screen again, and hopefully it will behave for me. It looks like it is. So you'll see our time is coming to a close, and it certainly has been awesome having you guys with us. And as I mentioned, we do have a very interesting gift here for you, and this is it right here. As you can see on the screen, we have, as a token of our appreciation of your time and participation, we want to offer you a free marketing strategy, a meeting with Lila Stone, who is the Business of Aesthetics and Marketing Director of Echo Marketing. Lila has established herself as a trusted expert in digital marketing and is passionate about empowering medical professionals with the marketing tools and knowledge to stand out in a competitive market. You can see on the slide in front of you that Lila has considerable specializations, and this gift is from the founder of the Business Aesthetics Institute, Narain Arulrajah, who also is the CEO of Echo Marketing, as I mentioned, who are a digital marketing organization specifically for doctors, their teams, and their practices. So you will see in the chat, and if you go to www.businessofesthetics.org/MSM, you'll be able to book a complimentary session with Lila at your convenience. Now, you get this kind of an offer, and I always say, like, well, where's the gimmick? What's the trick? And I can tell you there is no trick. There's no hidden cost. This is a gift from Narain. But I always look at these kind of opportunities through two questions. The first question is, what's at risk when I reach out and book a session? Well, I can tell you just your time. I think the second question is more to the point. What's at risk if you don't? We're talking about earlier, we're all experts at certain things. If you're an expert at marketing, then this might not make sense to you. If you aren't, it might be a great opportunity to help you take your marketing into a new level of professionalism, expertise, and results. So let me go ahead and just shift to our thank you slide. Thank you to our expert panel, Tracy Mancuso, Tracy Hata, and Kelly Conover. You guys provide so much insight, best practices, and actionable content. I think if I was going to put it together, I'd say collectively you made the complex simple, the hidden visible, and the difficult easy. Secondly, thank you to all our attendees for the privilege of your time and your participation. Without you, we don't grow together, and when we don't grow together, we don't set each other up for success. A reminder to like, share, and review us. We love reviews on your favorite social media platform, and you can go ahead and be part of someone else's success. So on behalf of our panelists tonight, and until next time, keep striving for excellence and exceptional patient care. Michael Walker, till next time. Thank you.
Great.
Thank you.
Thank you very much. That was amazing.
you.
Thank you.
Yes, thank you so much.
Thank you, guys. Just
Thank you.